All right, so you've got your MRCS coming up,
Hmm.
and today we're going to deep dive into a topic that's, well, it's almost guaranteed to be on there.
Yeah, for sure.
Fractures.
Yep,
We're going to cover a lot of ground.
absolutely.
We'll start with, the definition of a fracture,
Of course.
and then we're going to look at the phases of bone healing.
The body's pretty amazing at that,
Yeah.
how it all comes together.
Then we'll move on to a specific classification system.
Mm-hmm.
This one's super important for the MRCS.
Definitely.
That's the Garden classification for proximal femoral fractures.
Right.
And then we'll go over the 4 R's of fracture treatment.
Yeah, gotta have a plan.
And of course, we can't forget about the potential complications.
Always gotta be thinking about those.
So let's start with the basics.
Okay.
What exactly is a fracture?
Well, it's more than just a break, right?
Right.
It's an actual disruption in the continuity of the bone.
Like a discontinuity.
Exactly. And this disruption can be, it can involve one or both of the cortices.
Cortices meaning.
The layers of the bone. So that means it can be a complete fracture where the bone is completely broken.
Right.
Or incomplete where it's only partially broken.
Got
and
it.
for the exam, you really need to be clear on the difference between open and closed fractures.
Oh, right. Yeah.
Of course, is when the skin's broken.
So the bone's exposed.
Exactly. And closed is when the skin's still intact.
Makes sense.
Figure 4.2 in your textbook has a good visual guide to the descriptive terms.
So make sure to review that.
Definitely.
Okay, so let's say the bone is broken.
Mm-hmm.
What happens next?
Well, the body is pretty amazing.
Yeah?
It starts this whole healing process.
How does that work?
It's kind of like a 3-act play.
Ooh, I like that analogy.
First act, the reactive phase.
Okay.
This is the immediate response, right?
So what happens?
Inflammation, hematoma formation, the
Right.
body's saying, hey, something's wrong.
Sending in the first responders.
Exactly. Okay, so what's act 2?
Act 2 is the reparative phase.
Okay.
This is where the real construction work begins.
I see.
First, a soft callus forms.
What's a callus?
It's like a bridge, between the broken ends of the bone.
Oh, okay.
And then gradually that soft callus is replaced by harder bone, creating a stronger connection.
Like a scaffold almost.
Exactly.
Interesting.
And then we get to Act 3.
Grand finale.
That's right, the remodeling phase.
Okay.
This is where nature steps in to refine the repair.
Like the finishing touches.
Precisely.
So what happens during this phase?
Over time, the bone remodels itself,
Okay.
smoothing out the edges, trying to restore its original shape as much as possible.
So it might not be perfect?
Not always.
Wow, the body is pretty incredible.
It really is.
So now let's move on to a specific type of fracture that we see a lot, and it's a favorite on the MRCS exam. Proximal femoral fractures.
Right.
Can you tell us why the Garden classification is so important in this context? Well, the Garden classification basically stages these fractures based on how displaced they are,
Displaced meaning.
how much the bone fragments have moved out of alignment.
I see.
This is crucial because the treatment approach can vary depending on the stage.
Okay, so the more displaced the fracture, the more complex the treatment.
Generally speaking, yes.
Makes sense.
You'll often see exam questions that ask about the appropriate management for, say, a stage 3 versus a stage 4 fracture.
Right.
So you really need to know your stages.
Definitely.
Can I walk you through them?
Yeah, please.
All right, so stage I is an incomplete fracture,
Okay.
often an impacted valgus fracture.
What does impacted mean?
It means the bone fragments are kind of jammed together.
Oh,
Stage 2 is where the fracture is complete, so the bone is fully broken.
right.
But there's no displacement, the fragments are still lined up.
Okay, so that's good.
Yes, it makes treatment a bit simpler.
Gotcha.
Now, stage 3,
Hmm.
this is where things get a bit more complicated.
How?
It's a complete fracture with partial displacement.
So the fragments have shifted a bit.
Exactly.
Okay.
And then finally, stage 4.
Mm-hmm.
This is a complete fracture with full displacement of the femoral head.
So it's completely out of place.
Yes, and this is usually a surgical challenge.
Makes sense.
So it's important to be able to distinguish these stages both on x-rays and clinically.
Absolutely. It's all about choosing the right treatment for the right stage.
Exactly.
So let's talk about treatment.
Okay.
How do we approach these fractures?
Well, you got to remember the 4 R's.
4 R's.
Resuscitation, reduction, restriction, and rehabilitation.
That's a lot of R's.
I know, but it helps you remember.
Okay, tell me more.
So first, resuscitation.
Okay.
Always, always make sure the patient is hemodynamically stable before doing anything else.
Right, so assess ABCs and make sure they're stable.
Exactly, that's a priority.
Gotcha.
Then we aim for reduction.
What does that mean?
It basically means getting the bone fragments back into alignment as best as we can.
So like putting the puzzle pieces back together?
Yeah, kinda.
How do you do that?
Sometimes we can do it with closed manipulation,
Meaning?
manipulating the bone without surgery.
Okay.
But other times, depending on the complexity, we need to operate.
Right, more complicated fractures likely need surgery.
Yeah, exactly.
Okay, so that's 2 R's down. What about the other 2?
Okay, so restriction.
Okay.
This is all about immobilizing the fracture to give it the best chance to heal properly.
Like keeping the pieces from moving around?
Exactly.
How do you do that?
It depends. We might use casts, splints, traction,
I see.
sometimes even surgical fixation with plates and screws.
Makes sense?
And finally, the last R, rehabilitation.
Okay.
This focuses on restoring function.
So getting them back to normal as much as possible.
Yeah, we want them to regain their strength and mobility
How do you do that?
through physiotherapy and tailored exercises.
That makes sense.
It's a really important part of the process.
All right, you can't just fix the bone and forget about the rest. Now, we know things don't always go as planned.
Unfortunately, that's true.
So let's talk about complications.
All right.
What are some of the things that can go wrong?
Well, complications can happen early or late,
Okay.
and they can be local, meaning at the site of the fracture, or systemic, affecting the whole body.
Right. So a lot to think about.
Yeah.
Let's start with the early local complications.
Okay, well, hemorrhage is a common concern.
Especially with open fractures, I imagine.
Yeah, what else?
Damage to the structures around the fracture?
Structures like,
Nerves, blood vessels, even organs in some cases.
oh, wow, so it can be pretty serious?
Yeah, it can be.
Anything else?
Compartment syndrome is a big one.
That sounds bad.
It is. It's a serious complication where pressure builds up inside a muscle compartment.
Inside the muscle.
Yeah, and that can lead to ischemia and tissue damage.
Ischemia meaning,
Lack of blood flow.
oh, so the muscle isn't getting enough oxygen.
Right, and that can cause serious problems.
What are the signs of that? You'll see things like pain out of proportion to the injury,
Okay.
swelling, tenseness of the compartment.
So it's really important to recognize it early.
Absolutely. Prompt treatment is essential to prevent permanent damage.
What about early systemic complications?
Okay, so those can be really scary.
Like what?
Well, there's fat embolism.
What's that?
It's rare, but it can be life-threatening.
Oh, wow.
It happens when fat globules get into the bloodstream, often after a long bone fracture,
Okay.
and that can cause respiratory distress and even coma.
Sounds terrifying.
It is. It's something we always have to be aware of.
What else?
Hypovolemic shock is another one.
Right, from blood loss.
Exactly, especially with pelvic or femoral fractures.
Those can bleed a lot.
That's
Anything
it.
else?
And then there's thromboembolism.
That's blood clots. Right.
Yeah, like DVT or pulmonary embolism.
Deep vein thrombosis
Mm,
and PE.
right.
Those can be fatal, can't they?
They can.
Why are fracture patients at risk for those?
Because immobilization after a fracture increases the risk.
So lying in bed or having a cast on.
Exactly.
So it's important to think about prevention.
Absolutely. Prophylactic measures are key.
Okay, and you mentioned late complications as well, right?
Yeah, we got to talk about those too.
What are some of the late complications we need to know for the MRCS?
Well, non-union or delayed union can happen.
What does that mean?
It means the fracture just doesn't heal properly.
So it doesn't join back together.
Right, or it takes much longer than it should.
Okay.
Malunion is another one.
Malunion meaning?
It means the bone heals, but in the wrong position.
Oh, so it's crooked.
Yeah, and that can lead to functional problems.
Like they can't move their arm properly or something?
Exactly.
What else?
Joint stiffness is a common late complication.
Right, because they haven't been moving it.
Exactly.
Yeah.
Vascular necrosis.
That sounds bad.
It is. It's basically the death of bone tissue because the blood supply has been disrupted.
So the bone dies.
Yeah, parts of it can die.
Yikes.
And then, of course, infection is always a risk.
Especially with open fractures, I imagine.
Right, or if there's been surgery.
Makes sense.
So we always have to be on the lookout for signs of infection.
Wow, so many potential complications to keep in mind.
I know, it's a lot.
But really important to note for the MRCS.
Absolutely. They love asking about complications.
So any final words of wisdom for our listeners who are preparing for their MRCS?
Fractures are a big topic, but by focusing on the key concepts we've gone over today, you'll be in good shape for the exam.
That's reassuring.
Remember to really understand the classification systems and the principles of management,
Right.
and of course the potential complications.
Of course.
And don't forget to practice
Practice what?
interpreting x-rays
Right.
and applying your knowledge to clinical scenarios.
Absolutely.
The more you practice, the better prepared you'll be.
Great advice. Thanks for all that.
No problem. Good luck with your exams, everyone.
And to all our listeners, Good luck with your studying, and we'll see you on the next deep dive.
See ya.
Bye.
Bye.